The low kneeling thoracic rotation can be used for any number of things. I like to use it if I have a rotational restriction in the neck or low back that's painful and doesn't like being loaded so much. So if I do my cervical breakout and I look into the right, doesn't feel good, and I can't really load it that way, then I'll use this regional interdependence look, and I'll look either above or below the area of pain or dysfunction to see if we can find some non-painful dysfunction that we can improve upon. The low kneeling thoracic rotation does a really good job about that. So we're going to start with the knees nice and wide, forearms down in this triangular base here. I'm going to put my hand on the back of my head, or the back of my neck rather, and then rotating to the right and looking to the right as I rotate. I'm looking to the right because those top several segments in the thoracic spine move with the neck. So if I just keep the neck neutral here, it'll be kind of like I'm just moving through the shoulder. I want to make sure that I get that upper T-spine involved and I'm rotating up. I'm making sure I'm not shifting the hips around and compensating there. If you find that you have a difficult time keeping the hips still, you can kind of modify this by sitting back into almost a child's pose. So rather than keeping the hips high, you'll sit the hips back onto the heels, forearms down, and rotating from here. This one still works really well, but I like to keep the hips high if possible. If you're able to keep that good intra-abdominal pressure, stabilize the core, and not cheat by shifting the hips around, I like keeping the hips high because we kind of get a little more system integration that way. But if things are pretty sensitive and you tend to arch into the low back or shift the hips around and you just can't control it, that's fine. Sit back onto the heels in that modified child's pose and rotate that away instead. Give the low kneeling thoracic rotation a shot.